Hello everybody. So today in this video we'll be talking about a very important topic in both anatomy, that is neuroanatomy, and physiology, that is Parkinsonism. We'll be talking about its cause, its features, its pathophysiology, the symptoms that it causes, and also its treatment. So let us begin with the discussion. Parkinsonism is also known as paralysis agitans. Parkinsonism is basically a neurodegenerative disease of the central nervous system, which affects mostly the senile population. It was discovered, or in fact, it was described in the year 1817 by a scientist known as James Allen Parkinson, and therefore the disease itself was named after him. What is the cause of Parkinsonism? It is caused due to the degeneration of nigrostriatal dopaminergic fibers. So at this point, I suppose you are familiar with the parts of the basal ganglia and the different neurotransmitter released in the basal ganglia. Now let us talk about the features of Parkinsonism. The first being around 7 to 10 million people are affected worldwide by Parkinsonism. It is more prevalent in men than females, like 1.5 times more prevalent. Now, it has a sporadic idiopathic origin. Now, what is sporadic? Sporadic basically means not continuous or intermittent, and idiopathic means of unknown origin. It mostly occurs at old age, above 50 to 60 years. Now, it can also occur due to some other reasons, such as it can occur due to complication of treatment with antipsychotic drugs. There is a group of drugs known as the phenothiazine group of drugs, treatment with which can also lead to Parkinsonism. Now, synthetic heroin preparations can also lead to Parkinsonism. Also, it can be a result of the complication of encephalitis. Now, let us discuss the pathophysiology of Parkinsonism. In the central nervous system, there is always an equilibrium between dopamine, which is an inhibitory neurotransmitter, and acetylcholine, which is an excitatory neurotransmitter. But in case of Parkinsonism or Parkinson's disease, the level of dopamine decreases and the level of acetylcholine increases, because of which inhibition decreases and excitation increases. Now, if we try to understand what basically happens in Parkinsonism, there is a part of the basal ganglia, or in fact the brain, which is known as the neostriatum, which consists of putamen and caudate nucleus. And also there is a part in the midbrain known as the substantia nigra. It is black in color due to the presence of neuromelanin. Now, there is an inhibitory effect of the substantia nigra on this neostriatum via the release of dopamine. And the neostriatum has got neurons which secrete acetylcholine, which in fact is connected to the muscles of the body, which carry motor impulse and lead to movement in muscles. Normally, there is a balance between inhibitory effect of dopamine and the excitatory effect of acetylcholine. But in certain cases, like due to senility, what is senility? It basically means old age, or due to neurodegeneration, or due to some trauma, and mostly due to some idiopathic or unknown causes, the level of dopamine decreases. Now, since the level of dopamine has decreased now, inhibitory effect on neostriatum has also decreased, and in turn, the excitatory effect of acetylcholine has increased. Now, because of this, muscles are overexcited and they may elicit unwanted movements. They start eliciting unwanted movements, which we'll be discussing in the later part of the video. So this is what basically happens in Parkinsonism in a nutshell. Now let us talk about the pathological hallmarks of Parkinsonism. First, as we have already discussed, is loss of dopaminergic neurons in substantia nigra. A normal substantia nigra looks dark in color. Like if you take this section of the midbrain, you will see the substantia nigra layer will be very dark in color. But in case of Parkinsonism, it might have become pale. So that is a pathological hallmark of Parkinsonism. The second hallmark being the Lewy body formation. Now, what are these? These are basically abnormal proteins known as the alpha synuclein, which start accumulating in the brain and which leads to the symptoms, the classical symptoms of Parkinsonism. Always remember, the main function of the basal ganglia is to stimulate the thalamus. But in case of Parkinsonism, this stimulation is withdrawn, because of which thalamus does not get stimulatory impulses, and therefore there is slow action, slow movements of the muscles. So as you can see in this simple flow chart, in Parkinsonism, the dopaminergic input to putamen is lost, because of which there is decreased inhibition and increased excitation from the subthalamic nucleus to the globus pallidus internus, because of which there is overall increase in inhibitory output to the thalamus, and therefore there is disorganization of movement along with slow movements, lethargic movements. So now let us talk about the very important part of this video, that is the symptoms of Parkinsonism. The symptoms of Parkinsonism are 6 in number. So let us begin with resting tremors. Now what are tremors actually? They are alternate rhythmic contractions of the antagonist and the agonist muscle. Okay, these are resting in nature. That is, they are unintentional tremors. Now, if you have studied about cerebellar dysfunction, there it was intentional tremors. That is when you try to elicit a movement. Like for example, if you want to take this pen, if you want to pick up this pen, when you pick this pen, you have decided in your mind that you are going to pick this pen, and therefore the tremors start appearing. But as soon as you do nothing, that is your body is at rest, then the tremors disappear. Whereas in case of basal ganglia disorder, that is especially in Parkinsonism, the tremors will disappear as soon as you elicit a movement. Like picking up a pen will not cause any tremor. However, when your body is at rest, then the tremors will start appearing. Now, these tremors increase with anxiety and decreases with sleep. So we have completed resting tremors. Always remember, the thing that differentiates basal ganglia lesion and cerebellar dysfunction is tremor. In case of basal ganglia lesion, that is Parkinsonism to be precise, we have got resting tremors. Whereas in case of cerebellar dysfunctions, we have got intentional tremors. Now let's talk about rigidity. The person suffering from Parkinsonism does not show a lot of expressions. He or she has a masked face. In our normal day-to-day life, we show a panorama of different expressions. We are angry sometimes, so we frown, we smile, we cry, we make faces. But in case of Parkinsonism, this panorama or this plethora of expressions is lost, because the movements that they elicit have become extremely slow in nature. Okay. Also, the person is very rigid. He or she does not show a lot of flexibility in movement. The third symptom being akinesia or bradykinesia. Kinesia refers to movement and brady is slow. The person suffering from Parkinsonism shows very slow movement. Also, he or she has difficulty in initiating movements. The movements that he or she initiates are very slow in nature. They can either be slow or they can, in fact, in some cases can be absent also. The person walks with a stooping posture. That is, the person bends forward while walking. Then the person also has a shuffling or a fascinating gait. This will be demonstrated by this video.
Gait. When the gait is initiated, there are small steps. Oftentimes there's a tremor associated with this. And as the gait progresses, there may be a picking up of speed, or what's called a fenestrated gait. And then in turning, instead of having the normal turning, the patient will turn en bloc, which means they'll turn almost as a statue moving around. And then again having difficulty starting in the marche petit pas.
In case of shuffling gait, the person walks with very small steps so as to not to fall forward. Now finally, as the disease progresses, superficial reflexes are lost. Like in initial case of Parkinsonism, the superficial reflexes are present, so the Babinski sign is negative. However, as the disease progresses to later stages, superficial reflexes are also lost, and therefore Babinski sign is positive and it can also be elicited. So let us talk about the last part of the video, that is the treatment of Parkinsonism. Although once affected by Parkinsonism, there is not any permanent cure for the disease. However, the symptoms can be controlled to some extent by using certain drugs known as levodopa and carbidopa. There is a drug known as Sinemet, which is basically a combination of levodopa and carbidopa together. These drugs are used to control the symptoms of Parkinsonism. Also, there are certain substances known as dopamine agonists which mimic the action of dopamine. Like since there is a deficiency of dopamine in your central nervous system, these chemical substances mimic the action of dopamine and reduce the symptoms. These include apomorphine and bromocriptine. So with this, we have come to an end of this short video. So I hope you understood Parkinsonism, its features, its pathophysiology, symptoms, and its treatment. Do like the video if you find the content useful, and do subscribe to my channel because it gives me a lot of motivation. Thank you everybody.